Dr. Heilman, tell us about electronic medical records and the role they play in healthcare today.
Electronic medical records are the future of healthcare. Essentially, we're trying to deploy new records that allow people to document everything in a computer so that all that information can be shared amongst all physicians or clinicians who are taking care of a patient. It's going to be a game changer for us. It's going to bring a new chance to have an integrated medical record so that our patients will be able to be treated in our practices, in our hospital, and clinicians will be able to see all of their information in a seamless way. And it's just really going to open up the opportunities to take care of patients in a much better way.
And how is this going to play out in the future? Going to be changes, I expect.
Big changes. All hospitals, all doctors' offices are going to be required to make the conversion to electronic medical records by 2015 to avoid penalties by the U.S. government in terms of reimbursement. So there's a big push to beat that deadline as quickly as possible. Epic is a software company based out of Verona, Wisconsin. They design electronic medical records and have been doing it since the late 1970s. It's finally going to allow Norton Healthcare to be an integrated healthcare delivery network. By putting the same software within our practices and within our hospitals, all the physicians and clinicians will be connected via this software so that we can track a patient's care from the times that they're in the hospital or the times that they're in the offices, and it's just one congruent line. There's lots of opportunities to help us build. This is a big undertaking, and we're going to need a lot of people and a lot of help to support, build, and teach on the new system. So Norton is getting ready to Norton is going to advertise for roughly 50 positions to help us build this new software program. So anyone with a computer background who's interested in working in healthcare would be a good candidate. Also, any clinicians or nurses who are looking for maybe a different career change and want to get involved with building electronic medical records, they'd be great candidates.
Why is this a great opportunity for them?
Well, it's an opportunity to work for Norton Healthcare, which is a great employer, and I can't recommend it any more than I possibly can say.
And why is this a great opportunity for Norton Healthcare?
Well, it's going to be a game changer for us. It's going to bring a new chance to have an integrated medical record so that our patients will be able to be treated in our practices, in our hospital, and clinicians will be able to see all of their information in a seamless way. And it's just really going to open up the opportunities to take care of patients in a much better way.
And taking things to a whole new level.
A whole new level.
What does this mean for people who live here in the Louisville area?
It's going to be a great thing for us. Norton Healthcare already focuses heavily on the quality of care that we provide. By bringing Epic in, Epic uses the information technology or the computer program to help remind clinicians that there's even better things you can do, better screening, more frequent, whatever test may be indicated, or there may be a new drug. It's that smart technology that will help refer the physician or clinician to do the right thing 100% of the time. We all like to think we're perfect, but there's always room for improvement.
And it might prevent redundancies as well.
Absolutely. So if tests have already been done, the computer will remember that. It will remind them that they've already had a check or a screening exam done before, and it doesn't necessarily need to be repeated within that time frame.
Awesome.